Two guys here who work in the name of love, really. John Prosser, the vice president partner with Health Partners Home Care in Southfield and in Auburn Hills, where we're broadcasting. He's got patients all across the state, though. And John Cornack, the president of the Eisenhower Center in Ann Arbor. They are both with the Coalition to Protect Auto No Fault. And John, tell us exactly what you do at Eisenhower, because I've seen you in operation there. That is a labor of love.
It is. What I do at Eisenhower is go around making sure that the clients who have had catastrophic injuries get heard by the president of the company. I make sure that their goals, their needs are met, and we use a whole plethora of teams of, therapists, professionals, psychologists, and it's just a wonderful place to be. We have a nice mix of people.
You have patients who can't function outside of your facility. Correct? I mean, they're there because they have catastrophic
Yeah, that's correct. They have catastrophic head injuries. Many have behavioral issues that when they get out into the community, they don't have the right switches that turn on and off to kind of know how to behave. So what we do is we work with them a great deal out in the community and try to get them back to real life.
What would happen to those people if, in fact, the long-standing no-fault auto insurance law in Michigan were tinkered with, let's say?
Well, the folks that we have right now, hopefully they'd be grandfathered in, but people who are injured from this point forward wouldn't have a good place like Eisenhower Center to go. So they would be caught up in the mainstream. So they'd probably end up in skilled nursing homes and Medicaid, Medicare facilities. They'd end up, a lot of them would end up in jail, and many would end up on the streets. And sometimes people ask us what happens in other states, because there doesn't seem to be as many TBI people.
What does happen?
They're lost. They're underneath bridges and they're homeless, and it's really sad and pathetic. And I think that's kind of why we think other states should come on board with Michigan.
There is a mentality that it can't happen to me. That's other people things like that happen to. But John Prosser shocked me last hour when he told a vivid story of someone a week ago or last month hit a deer. We've all hit deer. He didn't drive to work that day thinking he was going to hit a deer and end up with a catastrophic injury.
170 accidents every day in Michigan. 4 people are catastrophically injured every day. This young man is 38 years old, father of 5, and driving down Foggy Road, and boom, there was the deer. He ended up rolling his car, and he's became paralyzed in his cervical spine. Just like that, boom. Nobody calculates it, and yet it does happen, and that's why we have this beautiful resource, because our legislature in 73 saw that people are going to need this.
And so the second that he was injured, he's covered by the no-fault law. He has for life.
That's correct. We're required in our captive state to buy this insurance policy, and it's a beautiful thing. But once you pay the money, you essentially have formed a contract with the insurance company, and you're entitled to lifetime medical benefits within the context of the law that says all reasonably necessary products and services for your care and your recovery and your rehabilitation at facilities like the Eisenhower Center in Ann Arbor. Or if you prefer to stay at home, that's what Health Partners does. We take care of people in the home.
And then no questions asked. It's already included in your insurance.
Well, there's no questions asked. That's correct. And it's driven by a physician's order. It's based on the clear delineation.
It's a prescription almost, right?
Well, that's exactly what it is. The doctor says, I see what you need, and therefore you shall have. And it's a beautiful win-win. It's the alternative in America is that everyone else goes bankrupt, Michael. 650,000 people suffer a brain injury and or a spinal cord injury in an auto accident every year in America. And if you don't live in Michigan, you go bankrupt. You suffer without getting what you need. You fall to Medicaid. It burdens the state government, doesn't give people what they need. And why? Because those legislatures don't know. And yet the governor of Florida, Rick Scott, wants to adopt the Michigan model, and we're working on trying to arrange those meetings right now. Might be a little bit of bad timing with the bill that's currently in the House.
Well, so in other words, the doctor says, you've had a catastrophic injury, here's what you need. That insurance covers it. If we didn't have that, the insurance company would decide your treatment, right? Here's what you can afford. Here's what we'll cover. Otherwise,
well, in the case of this bill that's up right now, the insurance companies would say, "Oh, thank you for your services and for the policy," and about $500,000 later, they would be out of the picture. So when they're looking at their statistics, after $500,000, you would no longer be one of their statistics. So you would have to find an alternative insurance. And that's where the $30 million shift over to Medicaid would happen within the first year, because this really emergency care work in the hospitals, the things they're talking about, the $100 million loss at their level, just means that the emergency system is going to change. And it's going to change fairly dramatically in the state of Michigan because of this House bill. So there's a lot of collateral damage, but it means that you wouldn't ever get to the health partners or the Eisenhower Center. Those monies would not be available to have this best practice model of care.
This is House Bill 4936 to, what are they saying? Adjust Michigan's no-fault insurance.
Well, they call it a reform. They want to offer people the choice to go bankrupt.
Gamble.
Medicaid right now is not accepting applications. So, the enthusiastic assertion by Mr. Lund, the House Insurance Committee chair, is saying, people will be able to get, just like John described, Medicaid or Medicare. That's patently false. He either doesn't understand what he's talking about or he's prevaricating. There are no benefits that give people the unique benefits contained in the auto no-fault law. Mm-hmm. And even if you're eligible, you cannot get anything from Medicaid. It is not accepting applications. When you can't fund it, it's closed. So the fact of the matter is we need to preserve, protect, and strengthen our no-fault law. It's funded by drivers for drivers. It has 15 years of reserves in the fund right now. That's $14 billion. There's nothing wrong with the system. Those of us that are on this side of the argument understand that, and we're simply asking legislators, ask the insurance companies for the evidence of their assertion that it's unsustainable. It's a false premise argument.
It isn't broken, don't fix it.
That's correct.
That's correct.
It's built into the auto insurance that you're compelled to buy if you're going to drive in the state of Michigan. How much per month are we paying?
$148 for the catastrophic, and about a third for the rest of the policy. So, if you were to take this away, there's no guarantee that you're going to even save that amount.
So, over the course of a year, it built into your insurance already. How much are we paying for the catastrophic coverage?
40 cents a day.
40 cents.
40 cents a day. You've got the average policy in Michigan is $1,000 a year. So your PIP portion, personal injury protection, is $150, and you add the $148 for the catastrophic. That's $300. That's 30% of your policy. The real area the insurance companies are trying to manage is the collision side. That's about 60% of your policy. They know that that's where their problem is, and yet they're trying to push this off on to citizens to dilute these benefits.
So for $12 a month, something like that.
That's exactly correct.
Coverage for the rest of your life if you're in a catastrophic
lifetime medical benefits for those poor souls that suffer catastrophic.
Best policy ever bought.
Thank you both very much. We appreciate it this morning. It's Michael Patrick Shiels, Michigan's Morning Show. You can learn more about this. Go back to the podcast at MichiganTalkNetwork.com, and we'll get you the other web address.